Hi, my name is Nancy Talam. I'm going to present vulnerable population as an issue that affects advanced practice nursing in partial fulfillment of Nursing 506, Professor Ines, and today's date is November 29, 2019. Vulnerable population are those who are at greater than average risk for developing health problems. Vulnerable population have been defined as groups deemed to be most susceptible to adverse outcomes due to limited resources or neglect. Most of them are not able to access health, or they don't even have health insurance. They include homeless, elderly, suffering from various chronic diseases, special populations such as Native Americans, low-income veterans, African American, some Hispanic population. I just found these statistics about HIV and AIDS diagnosis and death rate per 100,000 among teens and adults by race and ethnicity, and it shows that African Americans, or the black population as well as Hispanic, have high rate of diagnosis. Immigrants and the poor, including the working poor, have limited access to health insurance, or they lack insurance. Person exhibiting suicide or homicide-prone behaviors. Children, specifically, because they are still developing and they are prone to infection. Women, pregnant women, especially the teenagers. The elderly and vulnerable are also vulnerable to health problems because they are susceptible to infection or flu, influenza as well. And we have psychological issues such as puberty, menopause, osteoporosis, fractures among older women, and Alzheimer's disease. And this population, as we begin to prepare to be nurse practitioners in future, we're going to be encountering vulnerable population, and we should be prepared to be able to take care of them. That's just one of the diagrams that shows vulnerable population, older adults, communities of color, low-income communities, as well as children. We also have refugees, immigrants. This country is having a lot of immigrants that come in here, and then they don't have insurance, or they cannot access health. We have abusive family, chronically ill and disabled persons, people living with HIV and AIDS, mentally ill and disabled persons, alcohol and other substance abusers, and homeless persons. We see them in town. We meet homeless people. And I found this is an issue because historically nurse practitioners have cared for this growing population. Caring of this vulnerable population requires specific skills for optimal effectiveness. We have to be prepared to be able to take care of them. Nationally, vulnerable population accounts for this proportionate burden of disease and excess death. We have a lot of death from this population because they don't get health care. They don't have they don't get to go to the hospital because they cannot afford. There's also policies could intervene to help foster advance the role of nurse practitioner in serving this vulnerable population. Like regulatory, workforce, and education policies need to go hand in hand to build a sufficient and equitable distribution of NP workforce to serve vulnerable populations. Recently, we have Affordable Care Act that expanded insurance coverage and even gave around 11 billion investment in community centers, so that healthcare providers can be able to take care of these vulnerable population. Affordable Care Act as well have created increased demands for NPs to fill the growing needs for primary care among vulnerable population, thereby addressing these health inequalities. Policy makers to leverage and expand historical roles of the NP in caring for vulnerable population. Granting NP legislative authority to practice to the fullest extent of their education is also paramount. And we talked about this one when we were in class, that we need to advocate that nurse practitioners can be able to practice to the full extent, so we can be able to take away some of these restrictions. Developing more effective incentive programs with more lucrative compensation to stimulate NPs to be able to practice in rural areas and reserve areas. With these incentives, most of the nurse practitioners will be able to serve the rural and this vulnerable population. It appears that most of the vulnerable population live in rural areas and reserved areas, and most of the providers prefer to serve communities, especially in urban areas. So some of these incentive programs will be able to stimulate the nurse practitioners to practice in rural and reserved areas. Equipping nurses with skills and training required to provide high quality care to meet special needs for the vulnerable population. And APRNs are the leading edge with healthcare reforms. We are the policy advocates that we can push, so we can be able to serve our community. The shortages of primary care providers, especially among the vulnerable populations, and healthcare reforms are designed to address these inequalities, to take care of these professional shortages. The historic and evolving role of NP is providing care for vulnerable population has created an opportunity for nursing profession to have an even greater impact on the health of the nation. I also thought I should add the role of NP in primary care delivery for vulnerable population. Nurse practitioner role emerged in 1960 in a large part to address the projected physician shortage in providing care for vulnerable children. Currently, NP are the key providers in primary care setting, as they serve as the main source of primary care for more than 23 million minority and low-income patients, including nearly 1,300 community centers and over 250 nurse-managed healthcare clinics. NPs have contributed constantly to the health of vulnerable population through unique approach to care delivery. And this is the information that I found on Health Resource and Service Administration, HRSA, and we had that website in one of our modules. NP take a holistic approach to care of vulnerable population that emphasize community health, prevention, and social well-being. So, compared to physicians, NPs, they do a holistic, they do a comprehensive assessment to be able to take care of the vulnerable population. To conclude, it is critical to improve education for NPs to serve vulnerable population, providing adequate training and fostering interest in primary care in rural or undeserved areas among nursing students in advanced practice program is vital in the development of workforce pipeline to meet the healthcare needs. Strong interpersonal relationship is required, health promotion and patient education skills, patient advocacy skills, history and physical examination, comprehensive history and physical examination skills, and skills to be resourceful. We should be aware of resources available in our communities so that we can be able to take care of this vulnerable population, as well as being culturally sensitive. This country is full of immigrants, and we should be able to be culturally sensitive to be able to take care of this vulnerable population. The equitable distribution of expanding NP workforce in relation to areas of greatest needs is equally imperative. We need to advocate for equal distribution of providers so that we can be able to reach and take care of this vulnerable population. Opportunities for professional development and continuing education and training is also paramount to be able to retain the healthcare providers in rural and underserved areas. And I feel that vulnerable population is one of the populations that we really need to focus on when we start working as a nurse practitioner. And those are my reference, and thank you very much. Bye bye.